Everyone. Welcome to this workshop. We are very excited to have Dr. Donald Jenkins here. He is a clinical professor in the Division of Trauma and Emergency Surgery at the University of Texas Health Science Center. He's also a distinguished chair in the Burn and Trauma Surgery and associate deputy director of the Military Health Institute and a member at St. Anthony, the Greek Orthodox Church in San Antonio, Texas, and is presenting to us on Stop the Bleed, this incredible initiative that we are very excited to hear about.
Excellent,
Thank you.
So thanks for everyone for being here. We have a small group. I think it'd be great if we just went around and introduced ourselves. So as Naveem said, I'm a trauma surgeon. I spent about 25 years in the Air Force. I had an active role in the development of this program through the American College of Surgeons Committee on Trauma, and it's a good thing to know how to do, and I'm glad you guys are here to do it. So Evan and Karen are going to really do the hands-on stuff with us here today. I'm going to walk us through this American College of Surgeons standard presentation on Stop the Bleed. It's a combined effort of a number of organizations from emergency physicians in the pre-hospital world to include a group that I've been a part of since its inception back in 2000. The reintroduction of tourniquets into the military happened at the beginning of the current war, thanks to the smart thinking of this group of people here from the Committee on Tactical Combat Casualty Care. I can't talk to you about stopping bleeding without showing you bleeding, without showing you wounds, and so it's not. You don't have to look at the images, but it's going to help, I think, in the future, if you ever have to use this, to have been introduced to this at this time. Sorry about the contrast here. It looks great on my screen, but what this says is number one cause of preventable death following injury is bleeding, is what that says. And so conceptually, the only thing worse than someone dying of injury is someone dying of injury that could have been prevented, if that death could have been prevented. So where would one use this training? Well, things happen everywhere all the time, right? You spend most of your time in the office or at work or at home. And so just because that's where you spend most of your time, that's where these incidents are most likely to happen. Anybody that has a table saw or a dialysis shunt or is on a blood thinner, certainly car crashes, motorcycle crashes, these are things you may come upon the scene of. And having this education and training could make a difference in saving someone's life. So the first step in this is to recognize that the patient has life-threatening bleeding. And it's not always quite so obvious that if on a day like today, when someone in their motor vehicle would be completely bundled up, they could be bleeding, and that bleeding be hidden because of their coat and their long pants and so identifying that life-threatening bleeding is step number one. Step number two is actually call 911, but stopping the bleeding becomes paramount at this point. And there's different ways of going about this. We'll teach all of these ways here in the other room in a few minutes. So first things first is we want you to be safe. Shouldn't be getting out of your car and going into the middle lane of a 5-lane highway. If law enforcement isn't there to stop the traffic, etc. You shouldn't move towards a shooter to take care of someone if that shooter is still shooting. You should protect you so you don't now become a patient as well. So be safe first, and then we'll worry about the remainder to follow. And so one of the things here is shouldn't be too afraid of getting a little bloody. Wash up afterwards. You can always go and see your physician to determine whether or not you need to be tested or have any sort of additional care rendered. So first things first, like I said, is call 911. As soon as a first responder or medic gets to that scene, then you're off duty. Right, so you don't have to do anything anymore. It's their responsibility. So the sooner you get them there, the better. We're going to look for that life-threatening bleeding, and then the first thing we're going to try to do is just put pressure on it. How many of you have a tourniquet in your purse or your back pocket? Okay, Evan does. Okay, mine's in my car at home. She's got 2 bleeding control kits. It's Karen back there, and she's going to tell us about at the end. So we all have an ability to put a hand, a finger, a forearm, a foot on a bleeding site and try to compress it. So we're going to call that 911, tell them what exactly is happening, what the situation is, where we are. Sometimes they can talk you through things in case you needed a refresher. You can also just Google tourniquet placement or stopping bleeding, and you'll come upon videos that in real time can help refresh your memory. So we're going to look for that life-threatening bleeding. And it's continuous bleeding. It's the kind of bleeding that would create a puddle, if you will. That's a lot. That's a lot of blood, and that's the kind of bleeding that we're looking for. There could be more than one site that someone is bleeding from, so you don't want to just stop at the first place you come to where there is bleeding. Now, this next one is the first really graphic image. It's an actual bleeding artery, and I think we can agree that that's significant bleeding right there. And that wound from a motorcycle crash, that's going to bleed. It's not bleeding in this scene because they've already applied a tourniquet above that spot. And so when the bleeding is from the extremities, you have a lot of options. It gets a little tougher to control that bleeding when it's where those limbs meet the torso. And bleeding in the neck is particularly troublesome. I know that there's probably some people you wouldn't mind putting a tourniquet on around their neck, but don't do it. That's not part of the teaching. We're not going to teach that here today. And then the tough stuff is in the torso. So this is when you need me. Right, you need to be in the hands of a surgeon to get that bleeding under control. There's only so much you can do at that time. So holding direct pressure. So here's this fella here holding pressure on that wound. He's using some sort of a cloth there. I can't tell if that's a towel or a t-shirt or what exactly that might be. But we're going to put direct pressure on that wound. And what Evan and Karen are going to teach you is when you put direct pressure on that wound is to not press with your arms. It's to hold your arms still and lean into the patient because that isometric exercise you're trying to push on that is going to wear you out rather rapidly. And so you just want to hold your limbs stiff and push with your body weight against that person. So here's a demonstration of doing that. So they're showing you a wound. We have limbs like this next door. You can go to the American College of Surgeons website and pick up a t-shirt like this for about $25 if you want to get one. So see how she's leaning on the victim? She's not pushing with her hands per se. She is leaning on that wound there to get that bleeding to stop. So following compression, if that doesn't do the trick, then we may want to pack the wound. So you can use that same shirt or gauze, if it's available, to put packing in the wound. Now what we don't want to do is just try to put something over the top because that bleeding will continue in the tissues underneath. You want to stuff that thing just like you'd be stuffing a turkey on Thanksgiving. Put that stuff way down to the bottom of the wound and just fit in as much as you can. This hurts. It doesn't hurt you. It hurts the person. In fact, if you're stopping someone's bleeding and they're not complaining of pain, you're probably not doing something right because it does hurt to do this. And we're going to get some practice in doing this in the other room. Here's the demo. So they're using a specific kind of a gauze here to put in that wound. A shirt would work. Any kind of cloth would work. But you can see how they're pushing that down to the base of the wound to fill that wound with that gauze, and that pressure is what's going to help stop that bleeding. You don't need anything special, and you shouldn't be afraid to hurt this person. And then you're going to apply pressure for the next 5 minutes or until you are relieved by an expert. So that works very well on the arms and legs and in those junctional areas where the limbs meet the torso, as we had talked about. It doesn't work so much for the rest of the torso, as we had discussed earlier. Now, if compression doesn't stop the bleeding, we may need to resort to a tourniquet. We advise that you use a commercially available tourniquet, not a makeshift tourniquet. If that's all you have, you got to use what you got. But there's something about these commercially made tourniquets. There's physics involved with this, and the makeshift tourniquets frequently don't work how you would like them. And you're going to tighten this thing up, and you guys are going to get practice on each other, and it's going to hurt. But this is a good opportunity to see how much that hurts, because then you'll know you're doing it right when you do it for real. Sometimes that bleeding is not stopped by the placement of a single tourniquet. Sometimes it takes a second tourniquet. And what you want to do is you want to put that tourniquet between the wound and the heart. So on an extremity, you're going to go above where the wound is, closer to the heart. And that's going to stop the arterial blood flow into that limb. Okay? So here's a demonstration of that. We're going to imagine that there's a wound somewhere here around that elbow. So what this individual is doing is placing this tourniquet. They're going to slip this little Velcro piece in here, and then they're going to make that tourniquet as tight as they can right from the get-go. See how it's indenting that person's skin? And then they're going to bring that up to right at that point. Now they're going to use that bar, that windlass, to tighten that tourniquet. It's going to take a couple, 3 turns, and you want to tighten that until the bleeding stops. And then you're going to lock it in place, put that Velcro strip over the top to help hold it in place, and then secure the whole thing with this second Velcro strip. If you have the wherewithal, that thing says time on it. If you write the time, that's not important for you, that's important for me. To know what to do with that victim when they get to me, how long that tourniquet has been in place. If you don't think of that step, it's fine. We can always trace back to the time of the 911 call and sort of figure that out from that point. There are a number of these tourniquets out there available. Karen's going to show you some examples that they have available through Northwestern that includes all the stuff. Right, it's got gauze in there and gloves and tourniquet, etc. So you can buy an entire Stop the Bleed kit. I've got a tourniquet in every one of my vehicles and in my house. I got at least one at the church in a first aid kit for these purposes. You never know what's going to happen and when it will happen. There are also other tourniquets. A blood pressure cuff can be a great tourniquet. You just got to blow it up high enough, again, so that it stops the bleeding. There's no reason not to do the same thing in kids. The problem with tourniquets in little kids is that there's just by its design, it can only work in a certain size limb and above. So it's about a 5-year-old or greater that most of the commercial tourniquets work on. But the kid's blood pressure is also lower, and that's probably a lot easier to compress in that situation. If there's large, deep wound packing, there's no difference in an old person, a young person, a pregnant person. It's stopping bleeding is paramount. There are other things people ask about. What if there's, like an arrow or a bar or a little tree limb sticking out of a wound? You do your best to pack around it. You want to be careful if there's remember the image we looked at where there was a broken bone in the midst of a wound, that you don't get injured, by that shard of bone. If there's loss of an arm or leg, you're going to do the same exact things. You're going to try to apply direct pressure. You're going to try to put packing on that and eventually use a tourniquet. So these are the summary steps. It's pretty easy. It's going to be a lot easier once you do it. You can get more information at bleedingcontrol.org or stopthebleed.org. These videos are available there as well. And again, on behalf of the American College of Surgeons, we thank you for being here today. And if you didn't sign in on the sign-in sheet, please do so, so we can make sure that you get your certificate for this training event. And we're going to repair to the next room and do our hands-on bit, okay? Questions, concerns? Ma'am.
How much are the Stop the Bleeding kits?
Karen. Dean.
Are there tourniquets for children that you can buy, or?
There are pneumatic tourniquets that
Yeah.
you can buy,
Yeah.
but I think the old-fashioned T-shirt and like wooden spoon or
Sure.
windlass thing would probably suffice in a child because of the lack of depth of their subacute tissues. You want to try to not put a tourniquet over a joint because it doesn't work as well as it does just above the joint.
Yeah.
So.
So, if you guys are interested in Stop the Bleed or bleeding control kits, you can go online and Google them, and they are all over the place. They usually run about anywhere from $50 to $60. They also have ones that have chest seals and things that you guys were not trained in. So don't get the intermediate ones. You'd want a basic bleeding control kit. We do have them through our hospital. If anybody is interested in purchasing them, they are our cost. We don't make any money on them. When you get those certificates, Evan, if you just put my contact information in there. So they're in a vacuum sealed bag, and if anybody wants to look at the individual contents, I do have one that's open. We have a tourniquet, we have 2 rolls of gauze, an emergency, it's called an emergency trauma dressing. It's like an ACE wrap that has bandage built into it, and you can make a pressure dressing, and we're gonna work with that in the other room. There's also a pair of gloves and an instruction kit, just in case you forgot how to apply something, so.
And the beautiful thing about those tourniquets is they come with a little tiny piece of paper with the, now I remember, it shows you the steps of how to tighten a tourniquet. So it's built right in to the packaging of the tourniquet.
We also
27
do,
bucks.
$37
$37.
for these. We also do just sell the individual tourniquets if anyone's interested. Those are about $24.75, I think, is the cost for those. But and again, it's nothing that we make money on. That's what our cost is, and we're happy to share it with whoever wants them.
They also make commercially available kits that you can purchase for a school or for a church or something like that, where it would have maybe 10 persons worth of stuff inside of it. Most places that purchase those put them next to the AED that they have. You should check the airport. When you go to the airport, you'll probably see those kits. Our local grocery stores in San Antonio have them. There's a first aid kit. There's an AED, and there's a Stop the Bleed kit. It's behind the registers near the bathroom entrance in all of those grocery stores in South Texas. And so it's a standardized thing, and there's enough stuff in there for at least 10 people who might be injured to stop that bleeding.
Is there a certification required to teach this, like CPR?
Evan.
So it depends. Your background is what will determine if you can be an instructor. So if you attend this class and you're licensed as a nurse, as a
Nurse practitioner is right
nurse
here.
practitioner, any type of licensed medical background, there's a whole list we could go through. I can't even remember most of them. Ski patrol, veterinarian tech. There's a lot of people that can be. All you have to do is attend the class, go through the training, and you can sign up to be an instructor right online. If you're not one of those people, right now we don't have that option to allow people to instruct. However, you are welcome to be an associate instructor where you can help a licensed instructor or certified instructor teach. There's no certification process. It's just attending the class, being of a medical background, and signing up.
Yeah, so you can go back and teach this in your church.
Good.
Well, we talked about this briefly yesterday, but so if I wanted to like go back to Virginia, like I haven't really heard that much about this in Virginia or in my county, do I go through my hospital, or can, if I became an instructor, how would I like get started, like going to schools or churches and stuff like that? And teaching people?
So I would go to your trauma center because they have an outreach function that education is a part of. This is what Karen does here for Northwestern in this area of Chicago. And all of those trauma centers will have that capability. And they may not have encountered you and your folks that might need this yet, but just showing the interest is all that it takes for them to. And they'll put these. Like I said, we're doing 10 classes a week, many weeks in San Antonio from our trauma center.
Also, if you go to the stopthebleed.org, it'll show where they have contacts, and if you want to put on a class, you can put on a class. All that information is on the website, and that's nationwide. So, like if I wanted to take a class in Wisconsin, you could put in your mileage and range, and it'll show what is available in your area.
And for scheduled classes, when the next ones are.
Right, and you were also saying about becoming an instructor. You do have to go online, and there's a link that says instructor information, and you click on that, and you just fill out today's date as the class that you took, and then they grant you permission, and just as an instructor, then you get permission to all the videos and all the supplies, or not the supplies, we get to buy those, but you have like the sign-in sheets and stuff like that. You would have to keep those. They don't want you to send in the rosters to them. They just want you to send in the numbers of how many people took the class. So that's just a piece if you end up starting to teach. But feel free to contact one of us, or I imagine you too.
Yeah.
And we can walk you through that step if you're looking.
Yeah, we've taught classes to kindergartners and in nursing homes. And the entire gamut in between. Teachers are fantastic people that are exposed to the kids and just the place you want to be. That we do a lot of that kind of teaching. We do corporate teaching. So there's a reason why the grocery store has the Stop the Bleed kits in South Texas is because they took that on as a corporation. They're headquartered in San Antonio. One of the world's largest refiners is headquartered in San Antonio. We trained like 4,000 of their employees over a 2-week block of time this past summer. We've been to the colleges. Had conventions come to town that want 250 people trained that are attending that convention. And so there's a lot of very interested volunteers in getting out there and helping you to teach this in the population you identify as most necessary. So, great.
I don't think anyone in here is going to try and do it, but just keep in mind these classes are always free of charge, so you don't make any money off of it.
Yep.
It's all volunteer work.
Yep. All right. Well, let's go next door.